Hello everyone, this is Dr. Daniel Lev, and thank you for coming to my presentation on You Are Bigger Than the Pain, 6 Skills That Can Raise Your Comfort. This is a program that I put together after learning from other people in pain while working as a chronic pain psychologist at Kaiser and other places over the last 25 years. And this is an approach that can help people who are dealing with body discomfort that come from rat lungworm disease or fibromyalgia or headaches or back and neck problems. Whatever it is, it all travels through the nervous system. And as we go along, you'll understand what I mean by comfort and how to raise that by changing your nervous system. You can use this along with whatever medications you're using, or if you want to use the skills I will show you to help you reduce that. That's another goal, if that is your goal. I apologize for not being able to record my face, but I'm having technical difficulties. My computer just won't do it. So I'm just going to show you the PowerPoint right now, and I want to thank you for listening. So here we go. Well, there I am. What a great face. Anyways, what I wanted to do is let you know on this slide just a little of my background. Like I said, I did work at Kaiser for many years in an interdisciplinary chronic pain program. So we help people from using various approaches to show you how to get more comfortable, to work with you, to learn from you how you have gotten more comfortable and ways to enhance that. There's my number if you need to call me. Please feel free. And toward the end of the presentation, I'll also have my email address if you have other questions. So here's the basic idea from my years of experience, and that is when you pursue comfort instead of avoiding, controlling, accepting, or managing pain, you'll feel better, do better, and really more effectively take charge of your life. That's been my experience. And so what I will do in this presentation is unpack this, talk to you about what I mean by comfort and things of that sort. But some of you might be saying, what do you mean not avoid or control or manage pain? Well, how else am I going to get comfortable? And it's true, most of the approaches are pain focused. That means that they will give you drugs or try to do procedures to help you avoid or control the pain. There's even some psychological approaches that ask you to don't do anything, just accept the pain and move forward in your life. Some of these things can be quite useful, but I found that if you're trying to do that or you get training in how to manage, let's manage it like a company. Okay, pain, we're going to manage you. What happens is what all of them have in common is it forces you to focus on the pain. And so my approach is a little different in that it shows you how not to focus on the pain and instead focus on something. You can do something to increase your comfort level. So here we go. Here's the problem. Many of you may be aware of some of this, that there are 100 million people right now in the United States in chronic pain. And it can come about, as I said before, by any kind of a condition, whether injuries or diseases or malfunctions in your body. Now you're going to notice there are several pieces of art that I've put in here. And this is from a website called Pain Exhibit. And it's contributed to by artists who themselves are dealing with various kinds of chronic pain. So this artist in his description said, when I get a pain flare, I think it's headaches that he gets, that I feel like I'm in prison and I try to push my way through the bars, but I can only get so far. And that's what this expresses. Again, the idea that a picture is worth 1,000 words, figured it would be useful to understand that you're not alone and there are other people dealing with this. And hopefully in the organization you may be in, or if you're not, please find one. There are people that really want to talk and support around whatever the pain condition you're dealing with. 100 million Americans. That's a third of the people in the United States. By the way, that information I got from a very significant report called Relieving Pain in America by the Institute of Medicine back in 2010. Now you can find this for free online. If you have a bunch of printer paper and ink, you can do what I did. I printed the whole book out, or you can buy it just for the cost of the printing. But they interviewed researchers and doctors, psychologists, and people in pain to get an idea of what is most useful. And of course, they came up with the most useful approach, which is an interdisciplinary approach, not just physicians. And I'll come back to that in a moment. So you may have gone through some of these experiences that some people think you're a drug-seeking head case. You know, you're just in for the drugs. And most of us in the field know that most people feeling pain, even if you ask for a lot of pain pills, it's not because you're a junkie. You want to get more comfortable. I mean, it's a no-brainer. You're really more interested in comfort, not necessarily in the drugs. But if the drugs help, it's no wonder that you would be asking for that, or some people do. Other people try to make you feel guilty because of your limitations. Oh, you can't go on the walk? What's the matter with you? You know? And even though I believe you can do a number of things you used to do that you might not be doing now, you certainly can't do it the way you used to do it. And there are people who have expectations of that, try to make you feel guilty, and it's terrible. However, no matter how bad you feel now, it's important to remember that you weren't always feeling like this. In fact, most of you were probably pretty happy before the chronic pain came along. You were in relatively good shape, physically active, and you were involved in various social groups or family or friends, work. Speaking of work, you did work. You worked a job. Now, that could be a job at home, taking care of the kids and the family, or a job outside the home, or both. But now things are difficult for many of you. You might become enraged at times, or depressed. And your doctors, when you see them, they're either frustrating you or they get frustrated, or both. But fear not, because there's hope. And here we go with another picture. Now this one comes from the website Pain Art Exhibit, or Pain Art, Pain Exhibit. And this person's dealing with chronic fatigue and other problems. And you can see he's got all of these scary, almost painful to look at things around him. And his hands are in chains, but he's got this orange ball that represents hope. Because there is hope, even when we're feeling hopeless. I know it's easy for me to say this. I have dealt with chronic pain in my body in the past. So I know that there are moments where, oh my God, nothing's going to help. However, there is hope in a comfort skills approach, which is the approach I'm providing today. Again, as I told you, I worked in a interdisciplinary chronic pain program with body workers and physical therapists and physicians and acupuncturists, and myself being a pain psychologist. We all work together. And what I'm presenting to you is one part of that, which is the psychology piece, how you can learn how to control your nervous system. And that's what it's about. So let's consider your options so far. In the past, you might have had fix-it options. So you went, you had whatever pain problem started happening. You went for treatment, looking for, the medical test to tell you what's going on, and then finally kind of figure out what's going on. But it hasn't really helped. They just can't really do anything to cure it. So then they provide limited options. They give you medications or some medical treatments, various things, but these offer limited pain relief. And after some time, the only option that often is presented to you is no option. The doctor will say, I'm sorry, there are no more options. You'll just have to live with it. Now, I don't know about you, but many of the folks I worked with, when they heard that, it sounded like you're doomed. Because it's a doctor. Most of us go to the doctors. They're supposed to fix it. And oh my God, the doctor can't do anything. I'm doomed. However, you have one more option. And it's a good thing they're wrong, because there's one more very powerful option. You have you. That's right. And with the right skills, you can handle very heavy challenges. You can increase your comfort level. And I'm going to move into a little bit about chronic pain by answering these 5 questions and how you can utilize yourself and things you can learn that can help you feel more comfortable around the pain. So we'll look at, like I said, a brief little introduction to how pain works. Some of you might be aware of that, some not. Secondly, things that you and other people in pain have in common, what you're experiencing. Then the third question is, how do pain, misery, and comfort differ? And I'll define some terms so we can figure out exactly what I'm talking about by comfort and pain and misery. Number 4 is how my particular approach, the personal comfort approach, works out a lot better than just going to doctors or healthcare professionals or even alternative medicine professionals, who all have one thing in common, and that is that they will do things to you or give you something that will do something to you to help you feel better. And these can be great, and I'm not putting them down, but they're not working well enough, at least for most of the people I've worked with. So I'll show you how the personal comfort approach can be helpful. And finally, what are comfort skills and how can they help you? So we'll go through that. As far as questions, if you have questions of your own as we're going along, write them down, because I'm going to give you my email address, and that is a way you can contact me to get whatever answers I can provide, or if you need to discuss something with me, it's perfectly fine. So here we go. What is pain? It's a little introduction, and here is yet another picture, and this one is by, I think, a woman artist. And when I'm doing my comfort skills workshops, I'll ask people, what do you think she's suffering with? And most people guess, yes, it's migraines. And so that's her experience of migraines in her art form. Hypersensitivity, and we'll come back to this too, because it bears repeating. And by that, I mean nervous system hypersensitivity. Not that, oh God, you're a sensitive emotional person. No, but that your nervous system has been sensitized. Misery and pain, they tend to stress your nervous system. And when that gets stressed, it allows the pain signals to fire off even faster. Here are a few sources of hypersensitivity. One is inflammation. The inflammatory process in your body that can be set off by poor diet or other kinds of things can increase certain forms of pain. Opiate medications like Vicodin, norcomorphine, methadone, or many of the others that are out today, it's not that it automatically makes your nervous system sensitive, but the way I've described it to people is, imagine you're walking around barefoot. I'm walking around barefoot for at least 3 months. I never put on shoes. Okay, now if you're here in Hawaii, no problem, but most other places, oh my God, you may be walking around and step on things. It's going to hurt a lot. And the analogy here is, let's say you take your pain pill. It covers the nerve in a way. And so what happens is, if you're dependent on something covering your feet to feel comfortable, and then you take that off, your feet, the bottoms of your feet are sensitive, and so are your nerves more sensitive. They can become more tough to pain, actually. And so if I wear shoes for 3 months and then take them off, oh my goodness, the bottoms of my feet will hurt. But if I walk around barefoot for 3 months, then after a while, the calluses protect my feet. And there are people who I've worked with that decide to come down off the medication, and they actually can help toughen their nerves and reduce some of this hypersensitivity in their nervous system. Another one is the central sensitivity syndrome. And basically, our central nervous system is a bit out of whack when it comes to pain. There's certain conditions that definitely come out of that, like fibromyalgia, certain migraine headaches, irritable bowel syndrome, several other conditions have been identified coming from central sensitivity syndrome. And then there's social and psychological stress. And I'll come back to that later. But you probably know when you're upset or things of that sort, oh my goodness, you feel much worse. So what is pain? And there are various definitions, but the one that is most understood is from the International Association for the Study of Pain. And this is a group of scientists and practitioners and people in pain who are working together to try to find ways to increase people's comfort. And one part of their definition is an unpleasant sensory and emotional experience. So one might think, in other words, that pain is a mind-body experience. And I want to be careful right now because some of you may have come across, could be psychologists, could be physicians, could be people you know who say, it's in your head, or you're imagining it, or you're making it worse, or whatever. That's not what the mind-body experience is I'm describing. It's the way the process works. If I get overly upset, sometimes that will sensitize my nervous system and it will hurt more. But it's not just a mental process. It's a nervous system process that both the mind and the body can influence. Again, the mind and body, they work together through your brain and nervous system. And again, here I'm going to be, again, absolutely clear. Doesn't mean that you're mental and you're imagining the pain, because you know it's real. In fact, one of the funny things, I think it's funny, I do in my class is when people come in on the first day, I say, okay, how many of you are really in pain? And they give me queer, almost angry looks, and most of them raise their hand. I say, I will never ask you that again, because here we believe you, period. No question. You wouldn't be here if you were hurt, if you weren't really hurting. So I'm just talking about how that process works. So here's a couple of pain theories that describe this. One is the pain gate theory. And good old Ronald Melzack and Patrick Wall back in the mid-60s, they were studying the nervous system. And they found that there's actually, in your spinal cord, there's a place that acts like a gate to pain signals. And it comes into, this is a kind of a cutaway of your spinal cord. And these nerves come into certain parts of your spine and bring in these pain signals that come from something. So if you stepped on a tack, it would create signals which shoot up through into your nervous system. Here's another schematic, and this is really an important one to notice. And see my little pointer here. I'm just going to use that to show you something. So here is the pain fibers coming to your spinal cord over here. And here comes the nerve signals. And if that puppy's open, that gate's open, shoots right up the brain, and you hurt. You say, ow. But we're going to ignore this stuff over here. We're just looking at this part. And if you get stressed out and things of that sort, it opens this up even more, and more comes up. More of these pain signals. Now, what's really cool is they found that if you do something with your brain, like meditation, hypnosis, distraction, various other skills and practices, or raise your mood up, it sends signals down to the spinal cord that closes that gate, that makes it smaller. And when the pain signals come from here, when they come here, it's like they're hitting the wall. It's like they go splat, and they disappear because they can only exist if they're moving around. If they have to stop, they just fade away. So you can actually do things to change the spinal cord. I'll quote a famous psychiatrist who studies the brain, and his name's Daniel Lev, and he had a great way of putting it. You can use your mind to change your brain to change your mind. And of course, it all goes through the nervous system. So you can use your mind. Let's say you practice a little distraction. You refocus your attention while you're feeling some pain. Well, what happens is when you calm yourself that way and distract your attention, signals come from your brain. They start closing the gate. And so once it kind of closes, you're going to start noticing, your mind will notice that you feel more comfortable. So you're using your mind by using meditation to change your brain, changes the nervous system here, and that changes what you notice, because the person noticing is your mind. So it's really fascinating how through this one way to understand how you can make a difference in how your body feels. The second theory is central sensitization, related to what I was saying before, that when your brain and nervous system are sensitized to the pain. And so now it's just mostly happening there in the brain, despite the injury. The injury in the original pain experience has trained the brain to be sensitive. So a couple of factors that will sensitize the brain, either, tissue, skin, parts of your body, bone, whatever gets injured, And that turns the volume up in the pain perception. So like rat lungworm disease, fibromyalgia, back neck injuries can start creating that process, as I was saying before. Chronic stress can also set off this stress response, which then releases hormones, also moves you into a certain functioning of the nervous system, the sympathetic nervous system, sensitizes your nervous system, and then it can add to that sensitivity and add to the pain. So depression, anxiety, annoying people, and pain focusing, if you're over-focused on the pain, all of these can make it worse. So that's a little bit about how pain works. Question 2 is, what are you experiencing as a person in pain? I probably don't need to tell you, but just to let you know that I'm aware that numerous things are going on, and often they're kind of thrown together in this syndrome definition called the chronic pain syndrome. So it's this collection of negative experiences that are common to people living with one or more of these conditions. In fact, here are some of the conditions that folks will get this syndrome happening. Occurs within 3 to 6 months of the disease or injury occurring, like rat lungworm disease, CRIPS, the chronic regional pain syndrome, where the nervous system is really getting out of whack, and it's acting like, you broke a leg, but you didn't, but the broken leg is healed, but it's still not letting the rest of your nervous system know that you've healed. Carpal tunnel, other kind of repetitive movement injuries with your hands, arms, amputation or phantom pain, genital pain conditions, fibromyalgia, myofascial pain, various kinds of headaches or spine injuries, neck, diabetic or hepatic peripheral neuropathy, nerve pain comes from these diseases damaging the nerves. Additional pain conditions like pancreatitis, irritable bowel from the abdominal collection of problems. Rotator cuff, all the arthritises, nerve pain like trigeminal neuralgia in the face, musculoskeletal conditions, just the strained muscles, things of that sort. And then my favorite, unknown. You actually have a real diagnosis. It's called unknown. Just because they don't know what's wrong doesn't mean something isn't wrong. It just means the tools of science have not been able to measure it. So we depend on you letting us know, or letting physicians know, or psychologists such as myself. So here's some of the psychological and social impacts on people in pain. And yet here's another incredible artwork that expresses this person's experience with pain. Depression. Depression hits, I think, about 40% of people who are dealing with chronic pain. Anxiety problems. About 30% of folks have panic attacks or phobias or fears or constant worry. And unfortunately, this makes the pain worse. So does the depression. Anger and rage is very common. Strained relationships occur a lot. If your partners don't really understand or family members don't understand what you're going through. Sexual problems. Sleeplessness. So many people have problems with sleep. And the kicker is that if you don't get enough sleep, it makes the pain worse. So some of the skills I go over are how to actually increase your sleep and rest. And there are a number of other conditions. I won't overwhelm you with it, but fatigue, financial stress, self-isolation, spiritual doubts, boredom, these kinds of things all contribute or occur in people who are dealing with chronic pain. You may not experience all of them, but you may experience some of them. So now the third question, how do pain, misery, and comfort differ? And we're getting closer now to actually describing some of the solutions to this, or how you can get more comfortable around the pain. So the definitions of pain, a couple of kinds of pain. Acute pain, some of you are familiar with. It's short term, comes from various damage that may have occurred to your body. And when, creates these pain signals, when they reach your brain, you feel the pain. But it's important because it alerts you that you're experiencing a medical problem that needs attention. And when it heals, the pain usually goes away in less than 6 months. Now, chronic pain, of course, is different. It's caused by a non-lethal disease, syndrome, or injury, and medical treatment can only control it some, but it can't cure the condition. In fact, some of the medical treatments provided, like some of the back surgeries, are actually either not really helpful or can make things worse, depending. And if you have a surgeon, hopefully they are letting you know what the real percentages are of benefit from those procedures. Now, for some people in chronic pain, it's continuous. You have pain every day. Or like folks with headaches, it comes and goes, but it still comes and goes pretty often. Many of you are experiencing pain flares. And of course, those are times where the pain will surge higher and then finally comes down to the average level of pain. Very not pleasant, as many of you know. And in fact, if you can get the pain flares under control, life can become quite much better. So acute pain will give you important information about your body, but chronic pain's information is not always that useful. Knowing the pain's there isn't telling you you need to get it fixed because you've already done everything you could. In other words, chronic pain is not an emergency. It just hurts. The important thing about that is often the way our brain works, when we feel like we're feeling pain, we have to go get help for it. And often, as many of you discovered, there's not much help the medical world can provide. So that's why so many people in chronic pain keep going to the doctors, because they think it's an emergency, and really all it is the pain has been, your body's been irritated, you're having a pain flare, and if you can take care of yourself for a little while, it will come down. Misery. So misery is not pain. It's a normal but unhelpful emotional response to chronic pain and other stressors. It's really not pain. If you imagine I'm holding my hands up with my palms down, one side is pain, the other side's misery. So they're separate. However, if you imagine I raise my misery hand up, guess what happens with the pain? The pain will go up. And of course, that's because of the nervous system. So misery will increase when you overfocus on the pain, or on stressful events or people, or you focus on negative emotions like anxiety, anger, sadness, or on negative thoughts like, oh, it's all hopeless. As the misery goes up, unfortunately, the pain level goes up because the misery increases the sensitivity in our nervous system. So again, if you focus on the pain, on stressful events and people, or on negative emotions or negative thoughts, it has a good chance of increasing your discomfort. Now, one way to think about this is to imagine that the pain is like a fire. Even imagine misery on a certain level is like a fire. And also imagine that your attention, wherever you put your attention, is like lighter fluid. And then you could probably put those two together and know that when you aim your attention at the pain or at misery, it's like spraying a fire with lighter fluid. So much of my approach is to help you get, or show you how you can help yourself actually get more in control of your attention, because pain is just controlling your attention left and right. And it's true. It's, if you think of pain as like really a loud sound, it's very noisy. And so it's easy to distract us and grab our attention. Now, comfort is a little different. And this is where I differ from people, like I said, who want to focus you on managing the pain or controlling the pain, but instead to focus, instead of on pain, on how you can raise up your comfort. So let's look at what I define this as. It's a positive emotional state. It's the opposite of misery, and it helps you to feel better and do more. So comfort will increase when you focus on positive feelings and moods, on positive thoughts, on good people, and on pleasurable activities and experiences. And oh boy, is that easy for me to say, but it's not easy to do. And I understand for many of you, pain has been training you to focus on it and on misery for so long, it's really hard to even imagine a positive feeling or a positive thought for some of us here. Or on good people, maybe you don't have any good people in your life, and that's really hard. Or on pleasurable activities and experiences. But I will say that when you use the skills I'm going to show you or take certain actions, and maybe you're already taking some of these actions, you can start to raise your comfort level so that you feel better. Now, let me give you a little metaphor of what I mean by comfort. There's a different way to think about it. Imagine you're stuck in a room that is just, locked up. It's small. You're sitting in a chair. There's a pile of pillows next to you. And coming out of the floor is this steel grid that has the loudest, worst music you ever heard, just blasting away, driving you crazy. And you try to break it. It's not working. And then you look and you say, oh, I've got pillows. So you grab a pillow and you throw a pillow on top of it. And that muffles it. Oh, it's so much better. But it's still screaming under the pillow, but you don't know that because you've muffled it. Well, then you grab some more pillows. You throw 2 more pillows on. Oh, that's even better. Then you throw 10 pillows on it. It's like it's not even there. Even though under the pillows it's still screaming, you don't know that because you've muffled it. That's a measure of comfort. All those pillows are buffering the effects of pain on you. And when that happens, I notice with folks in my practices, and really everything I know, I learned from people just like you who are dealing with pain, that the comfort will calm the nervous system. And people describe it in one of 2 ways. Either they'll say, oh, there's less pain. The everyday pain goes down, or the intensity or how long you're in it or how often pain flares goes down. And that's wonderful. And that's a little bit, focusing on the pain, but that's how they describe it. However, other people will say, the pain's still there, but it's bothering me less, a lot less. So even though it's there, they're aware it's there, but it's not bothering them the same way. And often that translates into more activity and a more comfortable life. Now, how I recommend people do it is to use what I call comfort skills. And a number of these are things that people who do pain management or from other traditions, things that they recommend like meditation and things of that sort, they help. The main difference is I am basically repurposing these things to raise comfort levels and not to focus on the pain. So comfort skills, as I describe it, are a collection of practices and techniques that empower you to reduce both misery and the effects of pain by increasing your comfort level. And people use these skills, again, to reduce that influence and build a more satisfying life. And I have about 36 of them, which you probably won't need all of them. And in a little bit, I'm going to go over what they are just so you get an idea. The important thing to remember is that, any skill that you're going to use only works when you work it. It's like if you get a pain medication or you get a medication, if you don't take it, it's not going to work. Same thing with a skill. If you don't do it, you can't know how it's going to help. And again, even though I'm saying, rah, 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 all these are great, fabulous skills, guess what? We don't know if it's going to help with you. And so my invitation is, don't believe me. Try on the skill and use it as effectively as possible and see if it is helping. 4th question is, how is the personal comfort approach better than doctor care only? And I'll kind of buzz through this relatively quickly. The important thing here is just to differentiate what you may have been going through compared to a different way of dealing. So we're going to compare doctor care only to the personal comfort approach. Isn't that a cool cat? I love that cat. Anyways, this is a diagram with all of it, but we're going to jump into them one at a time under 4 different dimensions or questions. So what's the goal? With doctor care only, the goal is the doctor wants you to help avoid it. Take this pill, let's knock it out, let's bring it down, or let's burn these nerves, or do this surgery, whatever it is, we got to knock that pain out. With the personal comfort approach, it's to pursue comfort. That's the goal. And many of you have been to lots of doctor care only treatments, and you may not be so satisfied because they're limited. Medicine today is limited in many ways when it comes to chronic pain. How are you getting help? Well, if you're just doing doctor care only, You end up over-depending on doctors and healthcare experts. Often, I'd say about 90% of the time. Now, with the personal comfort approach, you start relying on yourself and what you can do to make a difference. And you do that at least 75% of the time. Now, why am I not saying 100%? That's because we need doctors. And if you have a condition, if you are taking some pain medications or some kind of physical therapy or whatever, it's helpful. So I'm not saying don't have that. It's just a matter of proportion. Depending mostly on yourself, you can start to raise your comfort level. And oh boy, I had this little girl one time I was seeing, she's 12 with terrible migraines. And a simple thing for her was to stop going to so many doctor appointments. Her headache started getting better. So we just, worked with her parents and she also to decide she's going to go to less doctor appointments. And just that alone was helpful. And eventually she got back to school with some other help as well. But it was really great. So relying mostly on yourself, but also somewhat on some medical care as you need it. Question 3. How do you reach the goal? So again, with doctor care only, we end up overusing or over-relying on medical or other treatments. Now, problem comes, that's the first thing in our head. Even if it's frustrated us before, we go for it. Where in the personal comfort approach, it's learning and practicing comfort skills and using a moderate amount of medical treatment. That seems to be really useful for folks, at least according to the research. Now, this fourth question is a little unusual. How does each approach view chronic pain? So often with the standard way of treating people, chronic pain is thought of as an ownership. You have chronic pain. It's in your body. It's there, And for some people that could be useful. But often what happens is folks will feel like, oh God, I got this thing in my body and I'm hopeless and helpless and I can't do anything about it except depend on doctors. And besides that, I don't know much about medicine or how to do health practices. I'm dependent on these people. Now, with the personal comfort approach, the idea is instead of thinking about pain as an ownership, think about it, imagine it as a relationship. You have a relationship with chronic pain. Now, it doesn't mean you don't have whatever condition it is that's causing it. But I find if you think about it a little differently, and meaning is really important when it comes to making changes in your comfort level, that when you change to think about it as a relationship, you actually feel more empowered because all of us know how to deal with relationships one way or another, relationships with our loved ones, with ourselves, with work. We don't need an expert necessarily when it comes to relationships. So if you imagine relationship, let me tell you 2 stories. One is a woman I worked with, and she came up with this on her own. She was really fabulous. I'll call her Sherry. And Sherry was in her 70s, and she had really bad arthritis. And she said, before leaving the house, what I do is I start to talk to the pain. And I say, okay, we're going shopping, and you better behave. Because if you don't behave, we're coming right back home. That's right. And so she'd get in the car and she'd drive. She'd go to the store and she's pushing her cart around and she's starting to feel some flare coming on. Then she said to the pain, what did I say? Didn't I tell you if you don't behave, we're going to go. All right, this is what we're going to do. We're going to leave the basket here. We're going to the car. I'm going to pull the seat back and lay back a little. And we're going to do 20 minutes of hypnosis because I had been training her in this. And if you don't calm down by the end of that, we're going straight home. And I'm just going to watch my movies. And fortunately, her body did calm down. She got to finish most of her shopping, and she went home. So that's one great example of relating with the pain. Another actually is fascinating. It has to do with meaning and the meanings that we have in life. And this is a true story. There was a physician named Beecher. And during World War II, he was a surgeon in the Pacific War. And I think it was Iwo Jima, but they would bring these soldiers in that had lost arms and legs and terrible wounds, and he would do his best to heal them. And then he would visit them in the ward, and he noticed something really interesting about them, that most of them didn't complain about their pain level. They said at most it was sort of a moderate problem for them. And most of them, what was it? Something like 70% didn't want pain medication. That's really odd. People with, blown off arms or legs didn't want pain medication. And he figured out what it was. And this became even stronger when, after the war, he went back to the States and he worked in a hospital. And he saw people from car accidents, other injuries that were similar to the injuries that the soldiers had. And he saw something interesting. This was the opposite. These folks, just regular medical patients, 70% of them wanted pain medication, and they complained a lot about the pain, and they worried a lot about the pain. And when he asked the soldiers earlier, well, I don't understand, what does this mean that you have this injury? And what do you think they said? To a man, and they were mostly men, they said, we're going home. We're not going to die. We're leaving the war. A lot of people didn't really want to be in that war. So for them, getting injured, the pain meant I'm going to live. It was a very positive meaning. But he found that the medical patients, when he asked them, they were worried about, am I going to be able to go back to work? And am I going to be able to be the father or the mother of my family? And all kinds of worries that the soldiers didn't have because they had a different kind of meaning. And so one thing I learned is, as you develop positive meanings in your life, whether it has to do with the pain or not, it starts to raise your comfort level. And just like the soldiers, you can feel more comfortable. And a lot of that can come with how you change your relationship with the pain. So the fifth question. And I know I'm kind of just moving through this. So fortunately, if you're watching this on YouTube, you can just pause me and think about it if you need to, if you find this useful for you. Anyways, I'm going to go on to the fifth question. What are comfort skills and how can they help you? And so I'm going to give you a little rundown on just about all 36 skills and give you a little taste test of a couple of them, okay, that I can do here in a PowerPoint recording. So I define the skills as a collection of practices or techniques that empower you to reduce misery and increase your comfort level. Comfort strategies are kind of the collection of how I kind of put into categories these comfort skills. And I had this wheel made with the 6 different comfort strategies. So I'll say something really kind of fast here about it, and then we'll take it apart a little bit. So you see, in the center is noticing. And what I mean by noticing is often a pain flare will just hit you out of nowhere. It feels like it's out of nowhere. And what am I going to do? And one thing you can do is you can start to notice beforehand certain things that will give you a clue that a pain flare might be on the way. And we'll look at some of those things you can notice. You can also notice positives. So the pain flare or emotional upset, because a lot of these skills can also be applied to psychological problems like depression or anxiety, things of that sort. But talking about pain, you can notice the negatives, but you can also notice positives happening. Oh, I actually felt a little more comfortable the other day. And just noticing that can start lifting you up in a good way. Now, above that are refocusing skills, and that's the collection of meditation, hypnosis, relaxation, things of that sort. Because I used to call it the focusing skills, but actually, we can't focus our attention. It's very difficult to focus our attention, and I'll talk about that in a moment. But those have been very helpful, the refocusing skills, in reducing the nervous system sensitivity, and that increases the comfort. To the right of that, in the red, are moving skills, and that's kind of a collection of 4 things that we are engaged in often in life, especially people in chronic pain, that you move through, and skills that help you move through them better, like sleep and physical movement, things of that sort. The enjoying skills just below that are just what it says, how to enjoy things. Because when you start having some fun, which most people in chronic pain for a while have a hard time having fun, and I can understand that, You have to start figuring out what are things that you can do that are fun that don't hurt your body. But as you raise your enjoyment, it actually starts to increase your comfort level. To the left of that are rethinking skills, catching negative thoughts.